Well, I'd like to welcome everybody to this very special event that's being organised by Australian Friends of Rambam. And we're talking about anxiety issues in children post-COVID. So I'd like to welcome everybody. But before I start, I'd like to just mention about our Cycle of Health program that we have at Australian Friends of Rambam, which is for the purpose of improving health and well-being in our community through disease prevention, positive lifestyle changes, and education. This is achieved by conducting a variety of health and wellness education programs using local expertise and strengthening global collaboration with top caliber facilities associated with the Rambam Healthcare Campus in Israel. Now, this special program of ours also facilitates research collaboration between Rambam Healthcare Campus and Australian medical research institutions. And there's somebody on the way from Israel, hopefully later this year. Now, Rambam Healthcare Campus is a 1,000-bed world-class teaching hospital based in Haifa. The patient population is diverse, as Rambam is the major referral medical center for all of northern Israel, serving more than 2 million residents, and others referred from all over Israel, the Mediterranean region, and around the world. Rambam is respected internationally for its clinical services and innovation in medical technology. Since 2014, the Ministry of Health in Israel has been monitoring patient experience via national surveys, and the results of the 2021 survey have just been announced, with Rambam Healthcare Campus being named as Israel's top hospital. I'm just waiting for this applause to subside. So today's webinar is on the important topic, as I just said to start with, anxiety issues in children post-COVID. Our moderator for this evening's event is Dr. Elizabeth Westrupp, who is a senior lecturer in psychology at Deakin University. She is a clinical psychologist who has focused her research efforts on understanding the biological, social, and environmental factors that influence children's long-term developmental outcomes. So I'm going to hand the reins over to you now, Elizabeth, and you're going to introduce this wonderful panel of experts that we have here on the screen.
Lovely. Thank you so much, David, and really excited to be here. We have a really interesting topic today that has affected pretty much everyone around the globe. So really, really important. COVID has really posed unprecedented risks for families and children right around the world. And here in Australia, we've certainly seen evidence of that. So in my own study, we recruited and examined over 2,000 Australian parents and families with children 0 to 18 years over 2 years and across 14 time points. And we've consistently found higher rates of mental health problems in parents and children, and particularly those families that were facing greater adversity, including strict pandemic lockdowns, higher rates of socioeconomic adversity, and also those who had pre-existing mental health problems. So tonight we really want to dig into that, understand a little bit more for those clinicians who are supporting those families day to day. So we have a fantastic lineup tonight of experienced clinicians who can speak to you directly about their experiences based on their roles throughout the COVID pandemic. I invite everyone listening to please post your questions into the chat, and we will have a Q&A session at the end where we will you're able to direct your question to a specific speaker if you'd like, and then we'll have a Q&A function at the end where we can answer all of those questions. So first up, we are going to hear from Michelle Graber. Michelle is the CEO of the Anxiety Recovery Centre in Victoria in Australia, and is a specialist mental health. So this is a specialist mental health organisation providing support to people and families living with anxiety disorders. So thanks so much, Michelle.
Thanks, Elizabeth. And thank you so much for inviting me to come along to this evening's presentation. And warm hello to everybody over there in Israel. Hopefully you're having some warmer weather than we are here right now in Melbourne. Look, I think this is such a very important topic. And one of the things, particularly I think that the global pandemic has done for anxiety is it started to put it on the map. It's actually allowed us to start talking about mental health more openly and destigmatizing anxiety. So from that perspective, I think there has been some good things that have come out of that. However, unfortunately, anxiety is far more than a fleeting thought or a feeling. And I think this is for some, it can be extremely debilitating and really start to impact on their ability to work, to study, and certainly impact their ability to have meaningful relationships, and can also impact on our ability just to function on a daily level. We're all dealing, as Elizabeth was mentioning before, with unprecedented uncertainty and major changes to the way we live our lives, how we've lived our lives, but also moving forward. And we find ourselves being in almost with our experiences and being into the third year, we're now starting to see the considerable impact that this is having on our children and our young people's mental health. We've certainly seen from the Anxiety Recovery Centre a huge increase in just in our helplines. We have a helpline that provides an information support and referral service for anybody that is trying to assist or anyone who might be living with anxiety. And during this period, we saw a huge increase, 232% increase on our helplines. We saw a number of people really struggling to navigate their way through this period, experiencing really long delays in getting the right help. We also saw some of those, probably over 60% of those inquiries from parents were from parents that had children in secondary school, so a significant impact of children that were doing their final year of schooling. And then we also had about 35% of those were parents that had younger children and really concerned about the social impacts, as well as the impacts upon having to do school. We saw an increase in parent anxiety as a result of having to do balance a household, balance our children's learning, also perhaps managing their own working commitments and so forth. So the parent anxiety was also extremely high during this period. For some, it's been a difficult process to navigate the best way forward. And as parents, there's been also a fine line, the balancing act of a lot of parents really concerned about when do I need to get some help? The fact that I actually don't want to make this worse. And I just don't know what to say. I don't want to say the wrong thing. So some of the simple steps initially and concerns of parents. With all of our experiences, this has certainly been unfamiliar, and we've had to learn to adapt to new ways that certainly has led to a lot of anxiety and parent anxiety. What we saw through that period, generally, there was also a report actually out by the Commission of Children and Young People. We saw that there was and young people particularly reported the fact that there was concern around the lack of social contact in restrictions, lockdowns, sense of loneliness and isolation. We saw that there was a loss of routine and coping mechanisms, general concern about study, employment opportunities. We saw this particularly in people that were doing their final year of schooling, and a general uncertainty about the future, looking at study or employment opportunities. Some people reported feeling quite worried about their family and friends, experienced fears for their own health. We saw young people reported during that process that their anxiety symptoms actually exacerbated. So for some people, for OCD, for example, for some people, their OCD symptoms had initially reduced, but with the ongoing restrictions and lockdowns, we actually saw that change over time. and there was an exacerbation of their OCD symptoms and anxiety, social anxiety, generalized anxiety. Some children also discussed, one of the increasing things that we started to be concerned about was the fact that people were worried about suicide, and that they spoke of being affected by their peers, worried about that their peers might also be experiencing suicide ideation, and how they might support them during that period. The concern of how to engage with family and friends. There was a big reliance, I think, on IT and Zoom. And I think we're all a little bit IT and Zoom exhausted as well. We also found people that were so anxious that actually, even though we had there was an increase in access to support through telehealth and making digital perhaps access to help more available and accessible. However, a lot of people didn't have the devices. Maybe they didn't have the smart devices, maybe they didn't have the capacity to engage that day, and they also had probably difficulties with even internet, simple things like that sort of prevented people from accessing help. Sometimes people also reported the fact that they couldn't get affordable help. So whilst here in Australia, we were fortunate where we had our mental health care plans, we saw them expand over time from 10 sessions to 20 sessions per calendar year. The underlying problem was the fact that a lot of people were going to be quite a considerable amount of money out of pocket. And so that made also help for many inaccessible, and that was difficulty also navigating the right sort of help. So for somebody, for example, that might be having OCD, we were seeing wait lists of anything up to 12 to 18 months during this period of trying to get the right help. For other people, it might have been anything from 8 to 12 months, but OCD particularly, we have was extremely hard to get the right sort of help during this period. We had long wait lists with psychiatrists certainly from the private health system. We were looking at a 9-month wait list for children. In the public sector, we were looking at anything from 6 to 8 months for a wait list. So we've gone through this period where it's been really difficult to navigate and find the right support in those systems, and then looking at what other sort of things can we do as parents in the meantime. I was actually approached by a number of schools and to do talks with parents, to do talks with young people, to do talks with actually teachers, looking at practical strategies of how they might be able to start to address some of the concerns that they were seeing within their students or within their young people. And I guess the biggest question was around, when does anxiety start to become a problem? When do I need to reach out and seek further help for my child? And I guess the rule of thumb that we would suggest is that if it is consistent worry for more than a 6-month period, when it significantly starts to interfere with a child's enjoyment of life, so things that they would normally enjoy, participating in activities, for example, the ability to attend school, or just the ability to function and have engaging relationships. If any one of those things starts to become complex and a bit of an issue, it's always best to seek help early rather than wait. So, and I guess the other thing that we started to see also was a change perhaps in our parenting styles. I don't think this is just actually a result of the pandemic, but we've gone from a stage where, sometimes parents, all good intentions, we never want to see our children struggle or have challenges. But I guess one of the things that I often talk about to parents is that sometimes the best thing that we can do is actually allow our child to struggle, allow our child to learn how to manage the difficult things in life. Because the more we shelter our children from disappointment, the more devastating some of those future disappointments will be. That we're kind of in this together during this pandemic, and it's something that we're all navigating together. And I think even role playing, sharing or our sort of anxiety with our children, that we can also learn to manage our symptoms is important. So I certainly saw that as something that might be helpful for parents as well, that your child's not the only one that might be experiencing anxiety. If we always solve our children's problems, I guess the other thing is that when they're actually not learning how to struggle or to achieve, how they can manage through those. So some of that is something that can be helpful, is allowing them to fight and learn from their own battles. As parents, we can support and encourage this, but it's important not to jump in and do everything for them. The more they take responsibility to work out their problems, the better that they'll learn from those and take those forward, develop some of those resilience and some of those management strategies. And I guess the other thing that's really helpful for parents particularly, and maybe is actually just allowing people to talk. Talking is the first step, the role of storytelling. And this is what I was finding from a lot of parents, is how do I talk to my child? What language do I use? I don't even know how, when I'm seeing something that I'm concerned about, how do I go about addressing that with them? Anxiety affects people differently. Everybody needs to be validated and heard. One of the things that we've learned over 15 years of being in mental health and working with the Anxiety Recovery Centre is most people want connection. Most people want validation and acknowledgement. And so as parents, one of the things that we can do is encourage our children to actually start to share their experiences through storytelling, which allows our children to process and express their inner thoughts and feelings out loud, which can be helpful for them. And it allows them to start putting their own words to their thoughts and feelings, as opposed to perhaps being told how they might be thinking and feeling. We can support our children by expressing empathy, and we can express empathy by just really listening, using active listening skills, trying not to jump in and solve their problems, trying not to suggest things that they finding a way out. It's actually just sitting with those thoughts and feelings with them, acknowledging those feelings. There's nothing wrong with having big feelings. In fact, all feelings, I think, through the pandemic, we've realised are valid and certainly are okay, and our children feel what they feel. It's important for those feelings and giving our children the opportunity to learn how to manage those feelings. Feelings can be felt both emotionally and physically as a result of a particular situation or an experience. So it's really important that we learn how to talk about those openly. Talking about feelings can allow some relief and allows them to process what's going on. So the language is really important. It's important to listen and respond, let them know that we're listening. The empathy allows them to elaborate on their feelings, and essentially will create a safe place for them to come to you to talk about how they're feeling.
Yeah, thank you, Michelle. That you have raised, you've done such a beautiful overview of all of the key elements and many of the issues for families. And I think those words of wisdom around parenting support are so helpful. And it may be that in the Q&A we get a bit more detail around that. That's the approach that you're outlining, sort of a emotion coaching parenting philosophy, is very much in line with my research. So it's got a nice strong evidence base. So thank you so much, Michelle. Really appreciate that. I was quite blown away by some of those stats that you described at the beginning. So yeah, really validating how important this is and how many kids and families have been affected. So next I would just like to introduce Dr. Tammy Templehoff, who is a clinical psychologist and the clinic director. She specialises in helping children deal with anxiety and behavioural issues, as well as offering parenting support. So welcome, Tammy.
Hi, everyone. Thank you, Elizabeth. Thank you, everyone, for asking me to join this incredible panel. I'm really excited to present to people both in Israel and here, and looking forward to hearing what people over in Israel have to say as well about this important topic. Michelle, that was really interesting. I absolutely agree with it all. A lot of it is similar to a lot of the things that I was going to say. So I'll just try adapt and add bits here and there about that. As Elizabeth mentioned, I'm a clinical psychologist. I have a practice in Elsternwick in Victoria. I opened the clinic during the pandemic, which in itself has been a really interesting experience. And, seeing how everyone at the clinic is addressing these issues, and we're kind of working from having, an overload of patients coming to our clinic during the pandemic, mostly through telehealth, basically all through telehealth, and then transitioning now to face-to-face is a really interesting experience for the clinicians and also for ourselves. So basically, as Michelle mentioned, anxiety rates are at an extreme high. And Elizabeth, as you said in your research, and as a lot of literature reviews have done, I read one published in the Gamma, which is like the American Journal, which looks at all aspects of pediatrics, that children's depression and anxiety levels have actually doubled since the start of the pandemic. And, I do think it's really important for us to look at the children's anxiety and then how that's linked, as Michelle said, to parent anxiety, because that has absolutely escalated a lot. David also interestingly sent us an article today that was published in the Australian yesterday by another psychologist, Claire Rowe, who talked about the pressures that we've had through COVID, but also talked about all the extra pressures, whereas the lockdowns are really the tip of the iceberg. So social media, all the tech stuff, different ways of parenting where people are struggling, as Michelle said, to really learn how to manage kids' emotions, lots of saying yes to kids. So all that mixed together has led to an increase in anxiety across both for parents and for children. So there's a lot of things to worry about, but as whoever knows me knows that I'm quite the optimist, and I like looking at ways that we can talk to children, to all my patients, to parents, about ways to help them, because I really believe with anxiety there's a lot that we can do to help people understand it, not be scared of it, know how to manage it. And I think that's really important, that a lot of kids come and say to me, I'm anxious, I've seen it on TikTok, I've seen it on the internet, I've seen it on Google, I have panic attacks. And I really slow them down and say, we all get worries sometime. How much of this is really negatively impacting you, and what are the strategies that we can use to help you manage a bit better? The first thing I do when I see parents, well, not the first thing, one of the first things I do when I see parents and kids is give them a bit of psychoeducation about anxiety. So really getting them to understand what it means. And we talk about a lot of the what ifs. And I think this is what COVID exacerbated, because it's a lot about fear of the unknown, fear of what if something happens. And COVID, especially for us Melburnians who had a lot of lockdowns and a lot of uncertainty, it was about, we were told there's this deadly virus. What if we get it? What if you don't stand 1.5 meters apart from each other? Then what will happen? If you don't wear a mask, what if this happens? If you saw pictures of nurses in PPE gear, what if that happens? And so when our kids came to us and asked us, well, what's going to happen? A lot of us didn't know the answers or didn't have the answers. And as Michelle said, that modeling, we probably weren't as good as we've ever been before in being able to give answers, to do reassurance. And that probably led to us being more anxious and to kids being more anxious. I remind people of, it's kind of been like a thunderstorm. If your kid comes to you in the middle of the night or at any time and says, I'm really scared, there's a thunderstorm outside my house. As parents, we know that generally speaking, we're going to be okay, that the kids will be okay. Our whole body language, our verbal body language lets the kids know you're safe, you're okay, giving them the language to be able to feel confident that nothing bad's going to happen. And I think what happens is we've kind of not been as good at that, obviously, during the pandemic, because we don't always have the answers for that. So I fundamentally believe, and I'm interested in everyone's thoughts about this, that in some ways, and especially with all our lockdowns, kids are fundamentally gone behind about 2 years in their emotional development sometimes. So when we've come out of lockdowns, what we're seeing in schools are that kids academically are a couple of years behind. Emotionally, I'm finding that they're a few years behind. So I say to parents, you know, if you've got a 16-year-old kid, think about as a 14-year-old what they could have coped with, what the language is that you can talk to them about. I think that's really important. And a huge thing is through modeling. You know, what can we do to help ourselves to then help our children? So there's two kind of, I guess, main areas that I thought I'll talk to you guys about in terms of strategies. And the one is the internal dialogue, which links with Michelle in terms of talking about emotions, letting kids know that they can have a positive internal dialogue to cope, and then absolutely about exposure. What we've always known about treating anxiety is that really what I believe is the best way is getting kids to experience whatever they're scared about. The huge presentations we're seeing is school refusal, or really scared to be going out to see their friends, people scared of big crowds, lots of fear, you know, different fears, definitely an increase in OCD. And what I talk about is really getting people to know that we're going to build them up so they have all the strategies, so that when they go out to these scary things that hopefully become less scary, they're well equipped, they've got their toolbox, and that they can manage slow exposure to whatever they're scared of. Letting kids stay home from school is definitely, I do not believe, the answer. Giving them the support definitely is. So we need to help kids to know that it's okay to have these negative emotions, or sad or scared feelings. That's not something that we have to shush off and say, you're fine, you're fine, you're fine. We want them not to use us as their number one reassurance seekers. For 2 years, really, they came to us because they couldn't go to anyone else. And now we want them to know you have the power yourself to believe in yourselves. I use sharks and dolphins as my huge analogy for adults and kids. In the ocean, dolphins actually beat sharks in fights as long as there's more dolphins than sharks, which not many people know. And so, yeah, it's about using positive thoughts and also exposing kids slowly with their support, I think, is really important. Remember, our kids are really resilient, and they will get through. Social media can be used positively and negatively, but I'll leave more people to talk about that. And yeah, and hopefully that's given some ideas about what we can give to our children.
Oh, wow. Thank you so much, Tammy. Really useful, really useful perspective. And I can see we've got our first question, which is great. So I will copy that over, and we'll present that to our panel very soon. So please do write your questions, and I think Michelle and Tammy have raised some really important points, and I think they offer some excellent expertise around how we can actually support kids going into the future. So next up, we have Dr. Paul Valent. Paul is a consultant liaison psychiatrist and a psychotherapist, expertise in trauma, and is also the co-founder and past president of the Australasian Society for Traumatic Stress Studies. So really looking forward to hearing from you, Paul. Thank you.
Thanks very much, Elizabeth, and thank you all. In this short talk, I will suggest that in order to understand adult and child COVID symptoms, we need a model for stress. And that is because most COVID distress is not really related to post-traumatic psychiatric illnesses, but to stress-related symptoms. And as an aside, please note that stress symptoms can be at least as disabling as psychiatric illnesses. In the early 1900s, the concept of stress was vibrant, but in the last 40 years, stress and its dynamics have been cast into the shadows. I experienced this cancel culture in the 1983 Australian bushfires, while our team attended to intensely mentally disturbed people. The authorities claimed that we had no business treating people who did not suffer actually illnesses. There was a breakthrough when Vietnam veterans demanded a diagnosis for their severe mental distress. And then post-traumatic stress disorder, or PTSD, which I'm surprised we haven't heard of yet, anyway, was reluctantly devised for them. But it was a confusing diagnosis because it said that stress resulted from trauma. It was sort of back to front. And once again, the intense stress symptoms were hidden in one overall diagnosis. So here is the dilemma. Everyone acknowledges widespread mental health consequences of the pandemic, but I will only talk for psychiatry, but psychiatry can only come up with anxiety, and you could see in the previous speakers how anxiety featured very greatly. So anyway, so all we can come up, and this is what we see over and over when we talk about COVID: anxiety, depression, domestic violence, and PTSD. Let's go back to the last century when stress was seen as an important factor in mental disturbance. That perspective held that different life-threatening circumstances elicited different survival instincts, like fight and flight. Now, those instincts continued post-danger resonances, manifested or called as symptoms. What type of symptoms? Well, they were biological, psychological, and social. A colleague of mine, Professor Sid Bloch, alerted me to his 2001 article in The Lancet, in which he wrote of a great 12th century physician, can you guess? Rambam. And he maintained that a person's disturbance encompasses the body, thought, imagination, and the spiritual, and the environment. So Rambam presaged by 9 centuries the biopsychosocial view of medicine. Modern stress medicine evolved to note that actually specific unresolved survival instincts led to specific biopsychosocial clinical pictures. And this is what I want to talk about, because this can be applied to the pandemic. And I can only provide a whiff of the richness of biopsychosocial symptoms that emanate from different survival strategies in the pandemic. So anyway, let's start with fight and flight. Fight. In the pandemic, kill or be killed fight manifested at the cellular level between the human host and the virus. But on macro levels, us-them suspicion, paranoia, and enmity surfaced as well. And they ranged from, well, yes, domestic violence to exacerbation of political divides in the United States, and even in Australia, Australian accusations of the China virus led to deterioration of the Australian-Chinese relations. So during the years of the pandemic, the world has become more precarious. Flight. Isolation and hiding were important pandemic survival strategies. Fear manifested in many physical symptoms, or you talk about anxiety, so fear and anxiety manifested in many physical symptoms, nightmares and sleeplessness, and the previous speakers described symptoms in children, that many of them that were associated with the strategy of, or survival strategy of flight, of getting away from it. There was a very obvious strategy of survival, which was rescue and saving people, so that doctors, nurses, and parents helped and suffered. They sacrificed for those that they cared for. And reciprocally, we had attachment of the sick and the weak who clung to and obeyed their carers. Many suffered longings and aloneness due to detachments, separations, and isolations. The young miss their schools, their friends, and romantic relationships. And then we have assertiveness or goal achievement. So let's deal with this virus. But many were frustrated at not being able to do much. They were not being able, they couldn't work, they couldn't do their normal daily things. Children were not able to go to school. So this could lead to demoralization and everything seeming to become harder. There was adaptation or goal surrender. And even as people adapted to lockdowns and so on, they also mourned, they were aggrieved because they lost so much. The depression in children was often not visible because they could be distracted more easily, they could hide their griefs. Competition resembled Darwin's survival of the fittest, and individuals, groups, and countries competed for food, vaccines, and resources. And let me finish with cooperation. And this was a less well-known Darwin's contention that cooperation actually serves survival of the species as well, if not better, than competition. So anyway, communities came together as never before. They helped each other, they joked, they created new ways of being. Perhaps you feel buffeted by this very abridged version of nevertheless fluctuating, sometimes opposite, biopsychosocial survival manifestations of the pandemic. Still, it's better to have a language which describes all these different stress responses than to be speechless or to be confined to 3 or 4 words, like, among them anxiety. Don't get me wrong, anxiety exists. I'm just saying that there's tons more than just anxiety. From our dictionary of stress, we can make meaning of patients' words. And they tell us they don't tell us words, I'm anxious, usually. They tell us all these other things that Tammy described. But how do we put them into some context? So from our dictionary...
Paul, I'm so sorry, I'm going to have to interrupt you there, but hopefully in the Q&A we have a bit more time to finish that thought. Thank you so much. That was a really nice framework for understanding the stress that occurs in response to the pandemic. Please do, if you're listening to our wise, experienced speakers and you do have a question, please do write it into the chat box and we will have time to go through those very, very shortly. But last up, I would like to warmly welcome Dr. Dana Amazar, who is a physician in the Pediatric Psychiatry Unit at Rambam Healthcare Campus in Israel. And Dana, I'm really, really excited to hear an Israeli perspective on the pandemic. So thank you so much.
Hi, and good evening to you all. And if someone wants to take a nap instead of listening to me, so I can tell you that we are in a real catastrophe in child mental health these days. And this is the summary of what I'm going to say. I'm afraid I'm going to be a little bit more pessimistic than the former speakers. And we are really in a catastrophe that we never knew even in times of wars and other stressful events that we have here, you know, from time to time, even quite often. I have a whole lecture with many slides that show the sharp rise in all the issues, but because we have 7 minutes and a half, right? So I prefer to talk to you freely. And we are, I want to introduce myself a little bit more. I'm a child psychiatrist, I'm a psychotherapist as well, and I'm a head of infant psychiatry service in a Rambam Medical Center, but I will talk mainly about some more older children and adolescents. We are in the middle of the situation right now, so there are no researches that can help us understand, and we are on the job and have to understand ourselves. We see a rise, generally speaking, we see a rise in all the psychiatric diagnoses between 30 and 60%. In all the psychiatric diagnoses, including depression, conduct disorder, all kind of anxiety disorder, sharp rise in school refusal, which is not really a psychiatric diagnosis, but it's really a main problem in child mental health. We see a huge rise in school violence. We see a rise in dozens of percents in use of psychotropic medication, new prescription of psychotropic medication. You know that in Israel, we are generally in a shortage of doctors, and especially in lack of child and adolescent psychiatrists and other mental health professionals. So when this shortage of professionals meets the current situation, we are not able to treat all the families and children that seek help. And it's really, really very, very difficult for us to. The waiting list, I don't know what's the situation in Australia, but the waiting list can reach many months, and I can say in some places even a year. As a result, the untreated children get worse, of course. The referrals to the emergency apartments in all the emergency rooms. In Israel, we have general hospitals like Rambam, for example, that have service psychiatric service, and we have also psychiatric hospitals. It's not the same. And there's a big raise between 100 and even there were some hospitals that say 400% rise to ER referrals. So we're really drowning. I can talk much more about the situation, but I think that the big question is why this really happening? Why is the catastrophe so great? There was a pandemic, okay, and we returned to normal life or the new normal, as we said, many months ago. I know that my daughter is flying to Australia in a few days for a trip with a friend. And I know from reading and from what she heard that Australia has really very strict and rigid policy of lockdowns and COVID policy. But in Israel, I think that we were maybe world champion. I don't know what was the situation in your country, but I think that we were first place in days that the kindergarten and school were closed. Children in Israel stayed at home for more than a year. So why it is so bad? Why it is so bad? You know, the Pink Floyd sang a long time ago that we don't need no education. So apparently this is not the situation. And apparently children need to go to school, and they need to go to school not only to learn things, but to practice school discipline, successes, disappointment, necessary interactions, and also unsuccessful interactions with peers. And all of this was prevented from them. And being more than a year out of school pretend to be very, very harmful. Another thing is we also have to conclude that home and families, even if they are good enough or more than good enough, or even excellent families, are not sufficient to fill the life, the mental life of our children. So I think that I must say that I worked for almost 30 years, and I'm quite amazed to see the storm, the mental situation that doesn't go down, and the referral doesn't go down, and I'm not sure what are the causes. Maybe we'll know it, in a year or 2 years, we understand it later. But now I think that we have to recruit, maybe to double our child psychiatrists in Israel in order to try to answer all the referrals. And that's all for now. Thank you.
Thanks so much, Dana, and thanks so much to all of our speakers for donating your time on a Sunday to come and speak about this really important topic. I think we had a question, which I guess is really just picking apart what are the key elements that might be driving all of these things that we're seeing in kids and families, all of these increased risks and increased rates of mental health problems. And COVID is a very complex, it's a complex phenomenon where we've had lockdowns, we've had school closures, childcare closures, as Dana mentioned. We've had parents who also, in Australia, and I think in Israel, but do please correct me, where parents were not always able to go into their workplace, and they were forced to work from home whilst often juggling supporting their child's homeschooling. Often, in Australia at the very beginning of the pandemic, a lot of parents had decreased work hours or lost jobs, even if it was only short term. And there was heightened stress. There's just so many things going on. And as the pandemic has continued, most of us have had experiences of COVID directly or indirectly through friends and family, etc. And many have had experienced serious illness. There's also many secondary offshoots of that, such as we've had a couple of mentions of screens being an increasing feature of home life, and less social activity, less reliance on all of those things that we rely on, such as access to childcare, supports from family, etc. So I just wanted to go around the speakers, and if you could just kind of pick one thing that you think is quite critical in terms of what's caused these increased anxiety in kids, and also what might be a potential lever for intervention for supporting them in the future. So if I can just start with Tammy.
Yep. There's a lot of things addressed, and I really enjoyed everyone's talk, so thank you for that. So I think definitely isolation, and really just not knowing what was coming ahead, how long lockdowns were going for, the social isolation, as Dana said. We actually are very social beings, and so being around people, connected to people, is really, really, really important. And without that, there is trauma, there is things that don't go so well. In terms of screen usage, it's such a two-way thing, because I guess without the screens, without all this technology, how would we have done COVID, decades ago when there were other pandemics? So on one hand, for our children, I think it connected them. I know for my own kids, they could do FaceTime, they could play their Fortnite games, they could do stuff that were annoying to me, but actually really good for them in terms of socially connecting to their friends. Without that, I think it would have been a lot harder. Now that we're coming out of COVID and they're seeing their friends in real life, there's screen addiction amongst all of us. And I think that was exacerbated from COVID. And so it's about learning how to manage that, how to navigate that, how kids all of us actually, can wind down and have a separated no screen time, so that they aren't too exposed to that, I think is going to be what we need to look into and to study. And I don't know that we've got enough studies on that yet. I don't know if anyone else wants to say something.
Thanks, Tammy. Dana, did you want to quickly address that?
I think that I read the questions that people were asking. I think that if we have to conclude and to learn something from the next pandemic that will come, maybe we learn that the next catastrophe will come, if not a pandemic, so something else. But like Tammy said, the lockdown and the prevention of social interaction was the most, I think, main issue that caused damage. And maybe for the next things to come, the conclusion is to try to let children as possible to continue with their lives. There was a they were thinking all the time in Israel, you know, because COVID wasn't really dangerous for children. The dangerous thing was for them to be in interaction with the parents and grandparents. So I'm not sure that closing schools was really necessary. Maybe it was not necessary. So.
Thank you, Dana. Paul, I just wanted to actually put that question from Shelley to you. So Shelley says, the catastrophe that you talk about, how does this compare to experiences previously in recent history, war, etc.? And how did these matters play out over the long term?
Well, the way I think is that, first of all, in the pandemic, everything and everybody was affected. And they were affected in many different ways. You know, for instance, as I said, they had to be isolated. There was no way of fighting this, this virus on their own. You couldn't really save your children, as it were. You could only protect them until the immunization came up. So in other words, from our point of view, every survival strategy was stretched. And it involved children, adults, families, work, society, and internationally, as I've pointed out as well. Now, whether this has been worse than other catastrophes, I would not say. I don't think so. When I think even of the bushfires that were fairly local and people were very much together and helping each other for a long time, the mortality rate and the morbidity rate following such bushfires was really quite significant. And so far, I have not heard of mortality rates coming out of this particular pandemic. I think they will come out. I mean, apart from the virus itself. From the bushfires, for instance, you had increased everything, biologically, strokes and infections and so on. Psychologically, people became depressed, suicidal even, and socially it created chaos. We're dealing with a very intense and widespread stressful situation, which does have all the hallmarks that Dana mentioned. But I think that there are common features, and it is these common features that I was trying to explain and describe. And of course, they all have their different nuances and emphases.
Yeah, lovely. Thanks, Paul. I think that's absolutely right, and a number of you have touched on this. Has been, you know, an absolutely huge event that's hit the entire world. It's been global, which is quite unusual. But as Paul, you mentioned, Australia unfortunately has had a number of events that were very, very stressful, and they happened one after the other. And I know the other side of the world is not immune to that either. There's always a lot happening, a lot of stressors, a lot of major events. And I can't imagine that's going to change soon. So Michelle, I'd love you to comment on, the pandemic has been so difficult. What do you think is a key learning that we can take away that we might be able to apply in future catastrophic events?
Yes, thank you, Elizabeth. I think part of it is actually just building on what Tammy was saying as well. It's just the whole dynamic. We're having to learn to redo things all over again. And I think one of the biggest things is actually re-engaging. How do we learn how to have those conversations again when we've been so reliant on screens and text messages? And I think, you know, how do we drawing on how do we sort of just engage with having those, whether it be through conversations, whether it's about going back to work, learning how to share things all over again when we've had this enormous fear of sharing toilets and facilities and rooms and things as simple as a pen and a computer, for example. So I guess it's really just looking at what our new normal is like. What did we learn? One of the things I think that was really helpful when I talked to parents was, what did we actually learn from this experience? What worked and what do we actually need to do differently? Where do we start? And just starting, routine really helps. And I guess it's about reestablishing a routine that works for us as parents, as well as for our children and our families.
Yeah, lovely. Thanks, Michelle. One of the expressions that we've talked about a lot in Australia is getting used to our new normal. And I think it's along those lines, isn't it? We're so resilient as human beings, but it doesn't make us immune to, experiencing significant stress and mental health problems when we just really have too much that we, can't quite, manage at one time. Thank you so much to all our lovely speakers. I'm going to hand over to one of the board members now for the final word. But I just wanted to give a really, really warm thanks to Michelle Greber, Tammy Templehoff, Dana Amisar, and Paul Valent. Your time and your sharing your expertise and knowledge has been just so wonderful tonight. So thank you. Thanks, Paul. Over to you, Paul Kissel.
Thanks, Liz. And again, I'd just like to concur with Liz and thank our panel of Michelle, Tammy, Paul and Dana. Fantastic presentations and expertise, and I'm sure our listeners learned a lot from it and can take forward what you've been saying. And also to Liz as an expert moderator for this evening's presentation. Thank you very much. I just want to also talk about our Meet the Experts Circle of Health program, and we do over the past 2 to 3 years, we've been doing many panel sessions such as this with expert speakers from both Australia and overseas, particularly Israel, on topics such as integrative medicine, ovarian cancer, diabetes, prostate cancer, and talking about advanced technologies in treating these. We will be having more of these sessions now that we're we're now in the new normal, and look forward to seeing everybody here again to our future panel sessions. One other thing I just wanted to mention before we do go is that if you haven't had a look at the AusForum website or any of our social platforms such as Facebook, to do so, ausforum.org.au. If you like what you see and you have an interest in donating, you can do so on either of those platforms. So, but otherwise, thank you very much for joining us tonight. Thank you again to our panel and our moderator. We look forward to seeing you again very soon. Thank you very much.
Thank you.
Bye.
Thanks, Paul. Thanks, everyone.
Thank you.
Bye.
Thank you. Thank you.